Now today I'll be reviewing the drug sertraline, which is an antidepressant used for depression and for anxiety. Now sertraline comes under the class of your SSRIs, known as your selective serotonin reuptake inhibitors, and what this drug does, it increases the levels of low serotonin levels in the brain, because the theory is that some people with depression have low serotonin, which can lead to your low mood symptoms such as reduced appetite, loss of weight, feeling down, social withdrawal, loss of interest and pleasure in activities, loss of energy. These are all symptoms of depression, and severe depression can include self-harm, very dark thoughts and suicidal thoughts as well. Now sertraline also comes under brand names such as Lustral and Zoloft. Sertraline is in my top 3 of antidepressants, and I'll tell you why this is in a minute. Sertraline, as I said, is used for depression, also used for anxiety, and can be used in those who have both depression and anxiety. Studies have shown that sertraline actually works better for anxiety than depression in a lot of people. Other uses of sertraline include depression in menopause, hot flushes in menopause, especially in women who are not able to take HRT, or in women who have a history of breast cancer and do not want HRT. Sertraline is also useful in women undergoing premenstrual syndrome, where you get mood swings and anxiety just before your periods. Sertraline comes in different doses. You have the 25mg dose, you've got a 50mg dose, and a 100mg dose. Usually when you're starting sertraline, you want to start off with the low dose, such as a 25mg dose, and then you want to gradually titrate upwards to the dose where you're feeling that the medication starts to work. So if you started on a dose of 25mg, usually you'd expect to start seeing some results within 2 weeks of taking the medication. So sertraline works quick in that sense. In some people, it can take up to 4 weeks to see the results of the medication. If after 2 to 4 weeks you feel that the medication is helping but you might need an increased dose, you can actually self-increase the dose to 50mg, or the doctor can advise you to increase the dose to 50mg. Most people notice that their mood symptoms are actually better between 50 to 100mg of sertraline. Now the highest dose is 200mg, and those on 200mg of sertraline tends to be those with severe depression and anxiety symptoms. So with depression, if you took sertraline, I would expect you to start seeing some results within 2 weeks. With anxiety, you might take you 4 to 6 weeks before you start seeing results of anxiety. And most people find that the 25mg of sertraline is actually enough for anxiety, while with depression, as I said, it's between 50 to 100mg, but majority of people find that 50mg is sufficient for depression and anxiety. Now in terms of side effects, similar to other antidepressants, so the common side effects include numbness, headaches, dizziness, disturbed sleep, loss of appetite, fatigue, and initially you might start feeling a bit more restless, a bit more anxious, mood swings, but it is thought that some of these side effects would resolve within 2 to 3 weeks of taking the medication. So it's actually worth persevering if you're having the side effects. Now the most common side effects tends to be reduced sexual libido, which is the most common reason why a lot of people stop taking these antidepressants. And also another side effect that's peculiar to sertraline, which you do not get with other antidepressants, is ibuprofen, or what we call anti-inflammatories such as the NSAIDs. Now if you take ibuprofen with sertraline, there is an increased risk that you might have a stomach bleed. So it is advised that you either take a tummy protector medication such as omeprazole if you're going to be taking sertraline, or alternatively try painkiller medication if you're on sertraline. Now why is sertraline in my top 3? As I said, it works quicker than most other medications. It works within 2 weeks for depression, whereas most other antidepressants work within 4 weeks. Sertraline is thought to be one of the safest antidepressants to take in pregnancy, unlike other antidepressants. And it also has less reported side effects than most other antidepressants. So I hope you enjoyed this short review of sertraline. If you want to hear other similar reviews of other antidepressants, then feel free to subscribe to my channel.